Hi everyone, my name is Edie Bellingham, a fellow government demographer, and today I'm going to report on population issues facing Singapore's nation. Singapore is a sovereign island city-state in Southeast Asia, and its current population is approximately 5.84 million people. Crude birth rate. The growth of population in Singapore was for a long period fueled by immigration, starting soon after Stamford Raffles landed in Singapore in 1819. After World War II, in the period from 1947 to 1950, Singapore saw a massive population increase, mostly due to increased number of native births, with it peaking at 47. By 1970, the Stop at 2 campaign was firmly established, implementing incentives, disincentives, and public exhortation to discourage families from having more than 2 children. In 1986, the government reversed its population policy and initiated the Have 3 or More campaign, offering cash and public administration incentives to have children. Crude death rate. The Singapore General Hospital was constructed by the 1950s, with better living conditions such as portable water supplies, hygienic disposal of waste, and more accessible medical care. These instantly reduced morbidity. In 1957, death to communicable diseases were dramatically reduced with increasing immunization levels. In the 1970s, Singapore began to industrialize, so the death rates were decreasing steadily. Lastly, in 2003, the SARS epidemic took its toll. There were 238 cases of SARS, with 33 deaths. Total fertility rate. In the 1940s, conflicts such as World War II resulted in women putting off having children due to the hazardous setting. The Singapore Family Planning and Population Board was formed in 1966 to aggressively promote family planning. SFBPB worked to promote contraceptive use such as condoms. From 1995 onwards, it was more socially acceptable for women to pursue a career, thus women began to postpone having children or eliminate the idea altogether. Infant mortality rate. In Singapore, the infant mortality rate was estimated to be 212 deaths per 1,000 live births in 1930. Japan's invasion and subsequent occupation of the island during World War II had a major effect on infant mortality in Singapore, with rates increasing from 152 in 1940 to over 230 by 1945. And after the Second World War ended, infant mortality would drop significantly as rapid modernization and foreign investment resulted in major changes in living conditions and healthcare. Life expectancy. Throughout the course of Singapore's longevity trends, there have been many downfalls, often occurring when conflicts such as World War I and II took place. However, in 2015, the average life expectancy at birth in Singapore was 84.4 years. Residents' average life expectancy has increased in the last 10 years, corresponding to the country's increase in economic growth. A predominant factor in Singapore's longevity is the exceptional health services and childhood disease prevention initiatives. While the birth rate was high in 1960, the death rate was also high since the next age group was slightly lower than the infant age group. Since there are so many people in the working age group and so few in the elderly age group, there is a low dependency ratio. And given Singapore has a booming economy, it is likely that females are working, hence effectively lowering fertility rates. For 2020, a constructive shape is typical for high-income countries due to better quality of life. For people aged 65 to 69, the number of seniors has risen dramatically, over 284,000. It also implies that healthcare technology rose as well, effectively lowering the death rate. However, there are less children because the ratio of people between 0 to 19 compared to that of adults is considerably low. And finally, in the year 2060, the pyramid began to resemble an upside-down pyramid. This indicates that birth rates are declining, implying that Singapore's population will eventually reach stage 5 of the DTM. There is also a high dependency ratio, meaning either the working population will have to give up a significant portion of their income to pay taxes, or the elderly will have to work. The reason for Singapore's high population density can be categorized as physical or human. Physical. Singapore's location in Malaysia's southern tip makes it an ideal shipping crossroads for ships travelling between ports. It's a perfect location for refueling, loading, and unloading cargo. Singapore also has an equatorial atmosphere, and even though the humidity can be unbearable, the lack of extreme hot or cold temperature coupled with consistent rainfall is appealing to people. Human. Singapore has one of the world's largest per capita gross domestic products. This ensures that residents have a high standard of living and have access to a variety of well-paying jobs. The economy, on the other hand, is well developed. The population pyramids of 2000 and 2025 clearly depict Singapore's trends. It is clear that Singapore's decline in fertility and birth rates are a major concern. This is easily seen as the difference between the number of children and adults have widened between the pyramids, suggesting that economic success can stifle the country's birth rates. Unless steps are taken, Singapore's new generations will be unable to replenish. The Singapore government previously introduced the Marriage and Parenthood Package in 2001 to encourage families. Despite these efforts, however, Singapore's TFR continues to fall. Thus, income support programs such as cash benefits and child-related tax benefits can promote parenthood by lowering the financial cost of raising children. This also represents another issue, the increase in elders. From 160,000 to over 568,000, the number over 65s has risen. If the number of senior citizens increases, it will have a major impact on the dependency ratio. With more older people to care for, Singapore's younger generations will be increasingly pressured. Increasing the retirement age is one way to prevent these consequences. Singapore's economy will continue to expand if more people are employed. Also, the Singaporean government could also develop an industry dedicated to inventing and innovating elderly-friendly goods in order to cater to the increasing elderly population.